fraction 6 today. Oops.
Yes. 6 of 28.
We're on the isosome shift.
So he's got 28 on this one. I thought it was 25. Okay.
You have 28 he wants.
Okay.
Total dose of 50/40.
I still have about 5 left, I think, when he's done with his thigh.
Yeah. Can you talk me through the spine one since I've not seen this one yet?
Sure.
This is the one that worries me.
Can you see how you can see him breathing? You see his lungs a little
Yeah.
bit. So this is like, this is a real time
Yeah.
cone beam. So this is his spine you're visualizing in the white here. He has this prominent vertebral space. We use that, that's just his front anatomy, and we use it to determine, how closely we're lined up each day.
Okay.
So we're gonna kind of match his spine to make sure we're on superior to inferior, all our vertebral spaces match up, where that little
Protrusion
is, that we're lined up appropriately. This is that paraspinous mass outlined again in green.
Okay.
And then we treat where the tumor is plus a margin.
Now this one isn't going into his spinal cord, it's treating the mass that's outside of his spine, correct?
Correct.
Okay.
That looks really nice.
So, I'll wait till you're done lining them up.
So did you have a question about the imaging, or?
Yeah, about when the actually the treatment itself, I guess, it's going all around him. So are the organs, like his lungs, is that what those that yellow, those are his lungs?
Those are his lungs.
So it goes through his lungs? I'm trying to understand.
Right, it'll be easier to show
anatomically
you.
correct.
Right, no, you're asking really good questions.
Let me just get it here. It's easier to kind of explain while it's being treated.
Okay, so 3 arcs. We're going to start on the first one, 201, 168, and 83.
Yes. So see how these that are moving in, did we show those two last
Yeah,
time?
those little leaves.
Right.
Yeah.
So
Mhm.
those shape the radiation as it's rotating around him to try and avoid treating structure.
Other organs.
Right, like his
Okay.
lungs and things like that. So you'll notice while we're treating, it kind of treats on like the posterior side of his body by where his spine actually is, and then it kind of stops treating on the top. And we can kind
Okay.
of point that out too. So like right now it's treating, and those are all moving to shape it around that tumor and the margin around it.
Okay.
And then somewhere a little more anterior, then it'll stop and it'll just rotate, but it won't be treating.
So when it's going over him, it's not treating him.
Yeah, I'll point out too when.
Over the top of
There's
him.
certain points where it's getting more blocked out and less radiation. So there's a over the top. See how little is coming
Yep.
actually out.
Yeah. Huh.
And all the organs in your body can tolerate a certain dose of radiation, and they call that a tissue tolerance dose.
Okay.
So Dr. Kittle would never prescribe a dose that would even come close to damaging the lungs. Because of where the tumor is, he has to give some doses definitely getting to his lungs, but he's doing whatever he can to minimize it, and he's getting this, this is the latest, the greatest. It's called IMRT radiation, which is intensity modulated radiation therapy. So he's using this technique in order to minimize the dose to his lung, his spinal cord, all those critical structures.
Sure. Okay. Because as Brent was trying to explain, I'm laying in there and it's going all around me. And we're gonna have a racing stripe of.
Oh, he's afraid he's gonna have a.
And it's like, oh wait a
Red
minute. So
line.
they're treating. I mean, in your mind, you think it's going all the way around him, treating him, and I'm like, there's a lot of stuff there that I don't know. That it's just. I
Yeah.
mean, I know you all know what you're doing, but the layperson's trying to understand.
No, that's fine.
Oh, yeah.
Yeah, so
Those are
that's why
great
those
questions.
leaves, he probably won't notice any, if just a little bit of redness on his skin for this part of his treatment.
Okay.
Because it is rotating all the way around, so the amount of dose going to each part of his body is very minimal.
Yeah, and
It's
he
just
said that
accumulative.
the dose of radiation on his spine is much less than it is on his leg. Is that right?
He's getting actually, so on his spine, he's getting on his thigh, he's getting a dose of 200 centigrade a day, whereas on his back, it's 180 centigrade a day. So it's,
Oh, so it's
20
just
centigrade different, a little
Okay,
less.
a little less. Okay.
And we actually love this new technology because years ago, like when Julie and I started doing this, we didn't have that, so the machine could only give you a square rectangle shaped field, and so we would have to manually make lead blocks that you would have to go in the room and insert at the top of the
Oh
machine
my.
to further shape the field like you're seeing now with these leaves.
So
Wow.
like right now it's not treating,
Okay.
so as it's rotating, this is how we know it's not treating, it's not turning yellow, and those aren't moving,
Okay.
and they're orange, so.
My aunt, who is in her 70s, was a she did x-rays and MRIs and was just starting to get into this whole therapy stuff
Oh, really?
when she retired. It was time. But she's very interested, and I'll come up with questions and she can answer basic questions.
Yeah, the treatment is so specialized now. It's great. I mean,
I'll put a sort of
they call it, the